This program is a paid commercial announcement and in no way represents the views of WPHT or its management.
Now on Talk Radio 1210, WPHT, WPHT HD, WOGL HD3 Philadelphia. Saturday Night Live with PhillyLabor.
If we don't move in our own direction, we're going to become extinct. In fact, in some cases, we're close to being extinct right now.
Presented by Weinerman Pain and Wellness. Serious doctors for serious injuries. And powered by the law offices of Pond, Lehocky, Stern, Giordano. Talk, listen, and speak to the region's most influential leaders. It's Saturday Night Live with PhillyLabor.
And a good Saturday evening, everybody. This is Saturday Night Live with PhillyLabor on Talk Radio 1210 WPHT, presented by Weinerman Pain and Wellness. It's a special edition of our broadcast tonight as we come on at 5 p.m. On a Saturday afternoon, and a good Saturday to everybody around the Delaware Valley. Welcome in. Got a great show lined up for you today. We're going to deal with two very, very specific topics. One, we're going to get in and have some conversation with our in-studio guest tonight about the Veterans Administration, about the VA, and then coming up for the very first time on Talk Radio 1210 WPHT, Governor Wolf J. Doc will join us as well. We'll have that conversation as we got an action-packed hour-long show this afternoon.
Absolutely, Krause. Certainly, we've been waiting for the opportunity to get the governor on the show for a long time. Really looking forward to talking to him and introducing him to the 1210 audience.
All right, good stuff, J. Doc, as we roll on and we begin our show in studio with us today. Mike Manning is joining us. Hello, Mike. How are you?
Hey, Joe. Thanks for having me on again.
Nice to have you in studio. Mike has a distinguished military career. He's involved in healthcare technology. We'll tell you what that means in just a moment. With Mike is John Peterson, the commander of the American Legion Post 405. Hello, John. Welcome into WPHT. How are you, sir?
Hi, Joe. Good evening. I'm feeling great.
Nice to have you here on a Saturday afternoon as well. And our good old friend, Dr. Albert Talone, who's a primary care physician from Weinerman Pain and Wellness, and he joins us in the conversation as well. Doc, a good Saturday, my friend. How are you?
Good evening, Joseph. Great to be here again, as usual.
Nice to have you in the conversation as well. Let me set the table for our listening audience. Our opening A and B block this evening is going to deal with the VA, and we're going to have some conversation about transparency, accountability. We're going to talk about data, and we're going to talk about patient compliance. And with those 4 bullet points, Mike, let me first give you the microphone to set the table on how all of those bullet points can factor into some of the technology that you, one, have now created, and two, find yourself on the doorstep of perhaps changing the lives of so many veterans.
Well, thanks, Joe. First of all, we live in the greatest country on earth, and I think we can all agree about that. And I always like to make sure that I acknowledge the veterans because they're the backbone of our society, and they're what keep us safe and protect us, and really are the examples for us in terms of ideals and everything else we care about. So anyway, what we'd like to talk about tonight is really where we're at. Last show, we were talking about the technology, what it does, and I'll repeat what that is. So basically, a veteran can now access with their smartphone, with their PC, with a tablet, whatever personal device they ordinarily use, a program that allows for them to request an entitled service, have that request in real time go directly to the individual who would ordinarily provide the service. That information is then communicated back to the veteran so they have an expectation on when to expect having the service delivered. And the great thing about it is if they don't get a response within a prescribed period of time, and that prescribed period of time is set by the VA, it goes up the chain of command.
Now, Mike, one of the things that's important, first of all, this being a labor show, this tremendous synergy with labor and our veterans and our military. We have a huge population of our labor union members and our labor leaders that are veterans who have children in the military. So there's a ton of synergy and a lot of commitment on our behalf. as you just explained about the new technology that's going to do incredible things for our veterans, let's also talk about the issues that they currently have, because they're vast. And I know this is a technology that you've been working on for a long time. So talk about some of the issues and then how they relate to the new technology.
Sure, and I'd be happy to tie it to labor also, because there's a natural tie to labor. And so the issues are, unfortunately, when veterans access the veteran centers and they're unable to get the services that they're entitled to, at least unable to get them within a reasonable period of time. Now, that is not to impugn the people that work at the VA, because there are, 380,000 people that work there. I would say that 95% of them are doing a great job, or they're doing everything they can. But this leads to another problem. They oftentimes have trouble understanding what their parameters are. So, for example, the new secretary, Secretary Shulkin, who's actually from Philadelphia, we just saw him at the Veterans Day Parade last week. He has actually publicly called upon citizens, business people like myself, to innovate, bring their innovations forward and collaborate with the VA, because the VA, that's a government entity. Private business is much different than the government. So the problem is really innovation and creativity and those types of things. So what we want to do is make sure that loss of life doesn't occur unnecessarily, and that taxpayer dollars are being used appropriately.
Let's bring Dr. Albert Talone into the conversation, a primary care physician from Weinerman Pain and Wellness, joining us here on Talk Radio 1210 WPHT. Doc, let me get you to weigh in on some of how this technology that Mike Manning is working on will help or benefit or assist the veteran or the patient. And then, John, I want to bring John in to follow Doc, and I want to talk about efficiency and transparency, John. But, Doc, let me first get you to weigh in.
Thanks, Joe. Well, as a veteran, I see many veterans in the private sector as patients, and, they both go to the VA and to their private physicians. And we've had no program where we've ever been able to coordinate between private practice and the VA treating facilities and information and ready access to information that would help us take better care of the vets. So when I listened to Mike in the beginning, I think he really locked on to something. I was really surprised, and I think it can change the culture of care for veterans and allow the private sector to interface with the Veterans Administration to give our vets a better level of care, better outcomes, and know that someone's watching them. John
Peterson is the commander of the American Legion Post 405. He's joining us as well. John, I give you the opportunity to weigh in. When we started the dialogue and we started the conversation, we talked about transparency, accountability. We talked about patient compliance, all big topics. We won't cover them all, but touch on them for me.
Sure. One of the veterans' main problems is that when he or she submits a request, it disappears from his or her ability to track it. So they do it in good faith. They're given assurances that it's being worked on, but they have no way to check on it and see what happens. And that's where the veteran service organizations come in, the DAV, the American Legion, the VFW, the Purple Heart Society, the IAVA. All of these organizations have an element of watchdogging where they hound the VA to make sure that these requests for care are being pushed through in a timely manner. What Mike's program does is facilitates the ability of a veteran to do his own watchdogging, his or her own watchdogging. They will get a notification where it is along the system. And as he said, if it gets stuck somewhere, that level's manager gets notified that it's stuck. So it's transparent to the veteran, and it's accountable through the VA.
Mike, with your technology, understanding, what the parameters are, what the goals are. From what I'm understanding, it provides the opportunity at a transparent process for the healthcare and the VA worker, for the management, and for the patient. And like John just said, is that extreme? Is that where the ball sometimes it's either dropped or it gets lost in the process?
Sure. So there are millions of encounters that occur across the country at the different VA centers. And so like any large organization, unless you really have modernized to the point that you can manage that massive organization, you're going to have problems. Right? So if you're obsolete, and in some cases, I don't mean to say that critically about the VA, but they obviously haven't modernized to the point where they use technology that people use every day to communicate and to identify and to understand where there are issues and where there are not. And that's what we do very specifically. I want to point out that in some cases, when we presented to the VA, people within the VA felt overwhelmed. They felt like all of a sudden they were going to get all these issues and needs that veterans had, and they weren't going to be able to manage them. And what we explained to those staff people is these problems are out there whether you want to acknowledge them or not, and these veterans are entitled to have them taken care of. And yes, in the beginning, it's like anything new. You've got to make adjustments, but by making this all transparent, the chain of command, Congress, the Senate, all the people who determine how many people you can have and how much money you can have in order to manage your operation, will then know precisely what isn't being taken care of that can be now and should be.
This is Saturday Night Live here on Talk Radio 1210, WPHT. Special guest in the studio today, Mike Manning, a distinguished military career and involved very actively right now in healthcare technology. John Peterson, who is the commander of the American Legion Post 405, with a big goal and a big initiative to help veterans. We thank John for being here as well. And, of course, primary care physician Dr. Albert Talone joining us. We're on Talk Radio 1210, WPHT. We're presented by Weinerman Pain and Wellness. We're powered by Pond, Lehocky, Stern, and Giordano. Back here live on Talk Radio 1210 WPHT. A good Saturday afternoon to everybody. Nice to be here on a Saturday. Normally here on a Saturday night with Saturday Night Live from 7 to 8 p.m. J-Doc, but we come in early tonight. We step aside for basketball on Talk Radio 1210 WPHT, and we come in at a 5 o'clock with a good guest and a good topic. Governor Wolf on deck, waiting to join us. We'll have the governor coming up momentarily.
Absolutely, Krause. Certainly some incredible conversation on today's show. That people can enjoy at the dinner table now. Dr. Talone, talk about the practicality of being able to have a transparent system and how much easier it makes your life when you're dealing with the veteran.
Well, if I understand correctly, I think what Mike has touched upon is total cultural change between, as I said earlier, between the private community of physicians and the Veterans Administration. Right now, there's a total disconnect between the private practitioner, veteran practitioner, and the VA. The VA is a big edifice. It's huge. It's
like the biggest healthcare association in America, correct?
Right, and it's very difficult for any of us to plug in. The only connection between them right now is the mutual care that we provide to our patients with the VA. When I heard about Mike's proposal, I really didn't understand it, but the more he explained it, then I began to understand. It's an informational technology, a service, that's going to be available to the average veteran, and it will take the edifice of the VA and bring it down to the level of the primary care physician in his office. So they can share information, trade information, provide a better source of care, a continuum of care. Healthcare is so complicated today. There's so many things that you can do for people. This way here, I hope that it changes the culture and we can interface, and I think what Mike's touched upon is very exciting.
Mike, it sounds to me like it'll once this gets integrated, this could actually make the life of the healthcare worker at the VA easier. It'll give them a system that they can work within. Absolutely.
Right now, they're limited to the medical record that they deploy, and I think right now the VA is actually moving to a new medical record. And that will create a lot of disruption for a long period of time. Our system, unlike the medical record, captures information earlier than the medical record does, and it provides information back to the medical worker who eventually puts it in the medical record. But what we enable is we facilitate the private, confidential communication in a structured way, so there's no free texting on this system. Everything on this system is what is known as standards-based. So as Dr. Talone was explaining, the kind of information that would be being provided back to the clinician, the doctor, the nurse, would be the type of information that they would ordinarily capture themselves if they were in front of the individual. This prevents them having to do that.
Now, the problems that have gone on to date, okay, just by the vast size of the VA across the country, individuals get lost in the shuffle. Talk about, and we talked about this before, I mean, veterans' issues as related to the VA. I mean, we're talking about, trying to prevent, this could actually, upgrading could prevent suicides, homelessness. Talk about that, John, and give us your insight there.
Sure. No one plans to be homeless. And certainly I would say a veteran least of all, because the veterans have had training and they've had a job and they've served their country and known what a sense of purpose is. So for them to fall into homelessness is really hard to understand, and I'm sure it's even harder from their point of view. What the system does is it does two major things. It can provide a safety net for those that are already in a hard situation. With simply one click on an iPhone, a kiosk, or a computer, they can get the help they need very quickly in terms of homelessness and other kinds of things. For the veterans who are not yet homeless but have risk factors, it identifies the risk factors early enough that they can either be sent a notice saying, hey, do you need any help? Or actually a worker, a social worker, a helper can go out to the veteran and see if they need any assistance.
John, I want to come back to you in one moment, Doc, but I want to start with you. Just a couple of minutes left, and I want to get everybody to at least weigh in on one last final conversation here on Saturday Night Live on Talk Radio 1210 WPHT. Patient compliance, Doc. Give me your thought on how this will help with patient compliance.
Well, patient compliance is the big boogeyman in medicine, unless they're compliant and they follow the regimen and the treatment plan and stay loyal to taking their medications and following the routine of care, care becomes fragmented, disjointed, and ineffective. So it's very important that this program will pay, I think, significant attention to the compliance issue.
Mike, talk about the cost of the new system that you've created, the new technology.
Sure. We did this intentionally. We've sunk a lot of money over the years in the platform, and what we wanted to do is make it affordable, make it feasible for every veteran and family member to be able to access. So it's free to them, but the charge to the VA is hundredths of a cent per day. So maybe 83 cents per veteran per year. Now, the closest thing to help you have a comparison would be anything similar to what we do would be $5 or $6 per veteran per month. So just multiply that over 12. I did want to touch on the compliance real quick.
30 seconds.
Okay, so from a compliance perspective, what it allows is a partnership between the doctor and the patient, and it allows for the patient to be able to provide information back to the doctor in real time as it occurs so they know whether or not they're compliant.
John, let me get you to close out our segment. In the pre-show conversation, we talked about, will the veteran use the technology? Can they use the technology? I know we're short on time, but comment on that for me.
The answer is yes. Veterans who are not in dire straits generally have access to the internet through a variety of different means, cell phone, tablet, computer, library. Veterans that are in dire straits also have access through the points where the veteran and the community intersect. And a great example is our Veterans Service Center here in Philadelphia. That would be a place where the veteran could access the system, have all their records there on the database, so that if they have a question, it can be resolved immediately.
All right, good stuff from John Peterson, who's the commander of the American Legion Post 405. Dr. Albert Talone joining us in studio. Doc is a primary care physician at Weinerman Pain and Wellness. And Mike Manning, distinguished, accomplished military veteran, corporate leader, healthcare management pioneer, inventor, and community leader. And I'm sure I didn't cover all of the other descriptions for you, Michael, but to all three, thanks so much for being a part of Saturday Night Live with PhillyLabor on Talk Radio 1210 WPHT. We'll take a commercial break. When we come back, we'll transition into our conversation with Governor Wolf, who will join J-Doc and myself right here. This is Saturday Night Live with PhillyLabor on Talk Radio 1210 WPHT. Back here live on Saturday Night Live with PhillyLabor on Talk Radio 1210 WPHT. Just one quick reminder from our previous segment. The technology from Care Partners Plus, J-Doc, is sitting right now on the Secretary of the VA's desk, waiting for approval. So good work done by Mike Manning and John Peterson, and of course Dr. Albert Talone joining us here on Talk Radio 1210 WPHT. We transition out of our conversation on the military and our conversation on the VA into Governor Tom Wolf, who joins us here on Talk Radio 1210 WPHT, along with J-Doc and Wendell Young, who is the president of the UFCW 1776. Governor, I welcome you into the show on the, I guess, about a month before you move into what is now year number 3. Sir, how are you?
I'm fine, Joe. It's good to be with you and Joe and Wendell.
Well, it's
nice
great
to be here, and I'm glad to. Yeah, it's great going into my 3rd year.
Absolutely, Governor. We're really happy to have you. I know I think this is the first time you're on 1210 WPHT, so we're going to...
Well, the last time we had Governor on Saturday night, or on the PhillyLabor show, we were playing audio of the Ice Bucket Challenge, and I think that was right before the governor was elected back in 15. So we still have that audio in the archives, Governor, but we did not pull it out.
Certainly.
Technically, I've been on before. That's right.
That's right. And from what I understood, that's what put you over the top. So
that's exactly what did. That's right.
So, Joe, so we're going to talk about a lot of things, Governor, and at the end of the day, Wendell, you want to talk to the governor about the current situation and the anti-union sentiment in the state.
Hey, Governor, thanks for taking the time to talk with us tonight. As you know, but for your listeners here today, our union represents over 21,000 workers in PA, including those who work at the state-owned Your Wine and Spirit shops. And, in recent years, many House Republicans have tried to blame state employees because they have good wages, benefits, retirement security for our budget deficits. As a Democratic governor, can you talk a little bit about how you have stood up for working families against this anti-union, anti-worker sentiment, and what are the real reasons for our structural budget deficits?
Yeah, no, Wendell, it's been interesting for me. I have now been in politics, as you point out. As of next January, it'll be 3 years, and that's the extent of my career in public service. I come out of a business background, and in my private sector business experience, I understand probably better than most that the fair treatment of workers is absolutely central to a successful operation. That's true in the private sector, and it's true at the public sector. So we actually get a bargain, we Pennsylvanians, in that we have really great workforce, public sector workforce, and they're worth every penny we pay them, and they do good work for the people of Pennsylvania. The reason we have a budget deficit is because so many generations of politicians, many of them Republican, haven't actually done what they need to do to pay for the things they want to spend money on. It has nothing to do with the workforce. In fact, the workforce, what I've found is I've been working very hard to try to make government work smarter and more efficiently and serve the citizens of Pennsylvania better. And in that, the workers in the state have been my allies. And so we've streamlined and made government more productive, more effective, more efficient. And so not only are public employees not adding to the deficit, they're helping to reduce the deficit. What we need is some help from the General Assembly to make sure that they are paying for the things that they want to spend money on. And this past year, we had a great example of that. We had a budget that was passed, the spending part was passed on time in June, overwhelmingly supported by Republicans and Democrats, including the Speaker of the House and the Majority Leader of the House. But then when it came time to pay for it, the House Republicans decided they just couldn't find the money, and they couldn't even show up for work. They were absent most of the summer. So it's not state employees who are at the heart of the budget deficit. It's poor management from the General Assembly, and I think we need to face up to that. Now, the other thing that you pointed out about the anti-union sentiment, again, that's another thing that I bring to this job coming from the private sector. I understand the importance of really good workers. And if you want to have a good workforce, you have to treat them fairly. That means in terms of compensation, in terms of benefits, in terms of all the things that you do, safety in the workplace. You do all those things right, you're going to have a very profitable and very, very productive business. And that's what I found. So when I come to this job, I come to it in terms of saying, this whole nonsense about not giving workers the right to organize with so-called right to work, that's bad. And something like that comes to my desk, I'll veto it, not just because I'm a Democrat, not just because I'm pro-labor, but because I know for a fact that's not very smart. It's a bad idea to take away the right of workers to organize, because that's unfair, and it's not good business practice.
Governor,
same thing with paycheck deception, all those other things.
Exactly, Governor. It is ironic because you come from a business background and you understand the value of workers and a well-trained staff. Why do we have such opposition to that concept on the other side of the aisle?
Well, I don't know. I mean, it's a great question, and I wonder myself because not too long, a generation ago, if someone had even brought up the idea of, say, right to work, they would have been dismissed as nuts. But today you actually have a party that is promoting that, and you have some states that have actually signed on to right to work. It's pernicious. It's bad. And I think part of the problem is that there are too few people like me who actually are willing to stand up and eager to stand up and say, right to work doesn't work. That's not right. It's not right, but it's also not smart. And I mean, I treated my workers really fairly. I was a non-union company. But after I retired, after I sold my share of the business, if those workers feel, for whatever reason, that they're not being treated fairly or that the workplace isn't as safe as it should be, they ought to have the right to organize and actually band together and make sure that management treats them the way they're supposed to be treated. And that seems to me to be a very, very fair way to handle the situation, and I don't for the life of me know why anybody would be against that.
Governor Wolf joining us here on Talk Radio 1210 WPHT. One follow-up to that, Governor, if we can. We'll stay on the conversation about jobs here in Philadelphia. A lot of conversation about the ports, a lot of conversation on this very radio program about pipeline investment and what that means. How do you see the picture of jobs for the state of Pennsylvania specific to those two areas?
Well, I think the job prospects should be very, very good. I mean, one of the things we're doing right now is trying to sell Pennsylvania to Amazon, and I'm really proud. I mean, you list all the things that Pennsylvania has, and we should be proud of that. But two of the great resources are, one, the Port of Philadelphia, and the Commonwealth in my administration, we've put $300 million into the port. We have a great board of directors in the Philadelphia Region Port Authority and the Delaware River Port Authority. Both of those good people who really are looking to create jobs. So I think that's a real resource. And the other one, of course, is our natural gas resource. I want to make that work for Pennsylvanians, which is why I keep calling for a shale tax, a severance tax that would make Pennsylvanians winners. by saying, we're going to have better schools because we have this resource beneath our feet. But we need to do it right. I believe a pipeline network is absolutely essential. Otherwise, we're just going to be an export state, and all of our gas is going to go down to the Gulf Coast, and it's going to enrich the folks in Texas and Louisiana. I want it to do good things for our schools, for our children, our teachers, all across Pennsylvania, and that means a robust pipeline. We got to do it right from an environmental point of view, but I think if we don't do it, we're basically forfeiting a really bright economic future that is ours for the taking if we do this right.
This is Saturday Night Live with PhillyLabor on Talk Radio 1210 WPHT, along with J-Doc in the studio, Wendell Young, who's the president of the UFCW 1776, and Governor Wolf joining us here tonight on Talk Radio 1210 WPHT. As we come to you, we'll have more with the governor back in a moment. Back here live on Saturday Night Live on Talk Radio 1210 WPHT, presented by Weinerman Pain and Wellness, powered by Pond, Lehocky, Stern, and Giordano. Along with J-Doc in the studio, Wendell Young, who's the president of the UFCW 1776, and Governor Wolf joining us here tonight on Talk Radio 1210 WPHT. As we come to you, we'll have more with the governor as we roll on. Wendell, let me transition to you. I know you had a question on some of Governor Wolf's accomplishments. I know we talked about it in some of the pre-show prep, so I tee you up, sir.
There's been a lot of polarization in politics, and some believe bipartisanship is lost. Can you talk about, some of your efforts and successes in the area of bipartisanship? And what if the obstructionists in the legislature were to roll up their sleeves and actually work with you? What could we accomplish?
Well, that's a great question, Wendell. I think the other side in the Senate, in many cases, has actually done that, and we've gotten some interesting things done. And to a certain extent, we've actually seen some of that across the aisle cooperation from members of the House. I mean, I ran on increasing education funding, and I've gotten this will be the third budget now, historic funding in those three budgets for increases for funding for public education, basically restored all the cuts that my predecessor made. We have expanded Medicaid, so we have 720,000 Pennsylvanians who have health insurance now who didn't have it just 2.5 years ago. Reached across the aisle, and we've done a lot with the opioid epidemic. And by the way, 125,000 people who have Medicaid are getting that their providers are getting reimbursed for the treatment they get for substance use disorder. So we've done a lot of things. Signed Libre's law, got anti-animal cruelty. There's still some work to do. We still need a severance tax, but there's real effort to reach across the aisle even there. Again, I think one of the things that we can be proud of is in Pennsylvania, there's still a lot of differences, and the General Assembly is made up of a lot of conservative forces, but we've been able to agree on some things and get some things done in a way that Washington, for example, has not. So I'm trying to present a case in a General Assembly that has an overwhelmingly Republican majority in the Senate, an overwhelmingly Republican majority in the House, and still, are there some things that we could actually do to get things done and distinguish ourselves from the dysfunction that everybody hates in Washington?
Now, Gov, we're as we talk about the budget, we talk about you mentioned the shale and the tax on natural drilling. I believe we're the only state in America that doesn't have a tax on natural gas drilling. How close are we to getting that, and what's standing in the way, and why the heck wouldn't we do it?
Well, I think we're close, but I've been thinking that I've been proposing this since my very first budget, and one of these days we'll get it. And I'll keep working for it. And here's the reason. As you point out, we're the only major natural gas producing state in the United States without a shale tax. I think we just surpassed Texas. We're actually number one in the country in terms of gas production. So we don't have a shale tax. They do. Texas does. Alaska does. Wyoming, Montana, Louisiana. I mean, what's wrong with Pennsylvania? And here's the challenge with that. 75% of the people of Pennsylvania say they want one. And the independent fiscal office says if we had one, 80% of that tax would be paid by people outside of the Commonwealth of Pennsylvania. I mean, what's not to like about this tax?
Right.
The other thing that you've got to remember is that all of us in Pennsylvania already pay a shale tax. We just don't pay it to Pennsylvania. Every time we fill up our car with gasoline, we're paying someone else's severance tax, Texas or Louisiana, or we're paying royalties to Saudi Arabia, whoever. And so when we fill up our tank with gas, we're paying somebody else's taxes. We're paying for Texas's roads or Alaska's schools. Actually, Alaska gives all that money to their taxpayers. They don't come with that money themselves. That's money that comes out of the severance.
And what are the benefits to it? How would we benefit as a state if we had one?
It would go into the general fund. I'd be happy if it all went to education. I mean, I think one of the things we could say is we'll have better schools as a result of a shale tax. We'll have our kids will have a better chance to learn. Our teachers will have more resources. Those are things that affect everybody's ordinary Pennsylvanians' lives day in, day out. This is not just pie in the sky. This would be a really big deal.
Governor Wolf joining us here on Talk Radio 1210. WPHT as we come to you around the Delaware Valley on a Saturday afternoon. Governor, something so simple and something so relevant to so many people. Hard for me to understand the reason why we can't get it done. Why so many people oppose?
Well, the dollars are pretty big coming into certain folks who oppose the shale tax.
Follow the money, I guess. Yeah.
Follow the money. I mean, it's sad because it is the great irony is that's why I said I think polls are showing, the overwhelming majority of Pennsylvanians support a shale tax, and most of it, the overwhelming majority of the tax would not even be paid by Pennsylvanians, and we're already paying other shale taxes that go to Texas and Louisiana and Alaska. I don't know anybody who's gotten a thank you note from the taxpayers of any of those states saying, thank you for paying for our schools and our roads and our bridges. And yet we don't have anybody paying for ours, helping to pay for ours. So it is the only thing you can think of is that somebody has decided for campaign finance reasons that they don't want to support this in the face of overwhelming support on the part of ordinary Pennsylvanians. It's just really a stunning testament to the power of money.
The 47th governor of the state of Pennsylvania, Governor Wolf, joining us here tonight on Saturday Night Live with PhillyLabor. As you get ready to go into January of 2018, your third year in office, Governor, thanks very much for being a part of Saturday Night Live with PhillyLabor.
Joe, J-Doc, and Wendell, it's been great being with you. Thank you very much for having me.
Thanks for joining us tonight, Governor.
Thank you, Governor.
All right, good stuff from Governor Wolf, who joins us here on Saturday Night Live. Just a minute or two left in the program before we say goodbye. Wendell, let me get you to weigh in and react to some of that dialogue that we had with Governor Wolf.
Well, first, I want to thank Governor for taking time to join us tonight. I think he's done a terrific job considering the strong opposition he's had in both chambers of the legislature. It's good to see that he's been able to reach across that divide and make some progress and some true bipartisan successes, especially with the Senate. But there's some more hard-headed folks in the House that have still tried to obstruct. And imagine how much better off Pennsylvanians would be if those folks would put as much energy into solving problems with the Senate and with the governor instead of just putting up hurdles and obstructing so the other side can't claim a win. I mean, this is hurting Pennsylvanians. It's hurting funding for education. It's hurting funding for infrastructure projects. It's hurting funding for health care. It's hurting, real solutions to real problems. And the governor's been a great example. He's gotten things done here that others in Washington and other states haven't been able to get done, but we need to do more. And one last thing, I wish we had more time with him because I know one of his passionate things has been the opioid crisis. He touched on it a little bit, but I think he deserves a lot of credit for being out there before it was popular to do so. And we have to find a way to help him with that because this affects our members, their families. This is a solution that really needs a problem that really needs us all to work to help better, or not better, but finish solving that problem.
We'll certainly extend the invite back to him as we're working on an opioid special right here on Saturday Night Live with PhillyLabor. Wendell Young, the president of UFCW 1776. Wendell, thank you much for being a part of Saturday Night Live with PhillyLabor. J-Doc, I can only give you 15 to 30 seconds to recap the night.
No, I just want to thank Governor Wolf for joining us and for what he does for working people in the face of a situation like Wendell said. It's very difficult up there, individuals that are putting politics before their constituents. And so we really appreciate his efforts and for him joining us on Saturday Night Live with PhillyLabor. And, of course, Mike Manning, Dr. Talone, and John Peterson.
Wait. That's my job to close out.
I was just throwing my 2 cents in, Krause.
All right, good stuff from J-Doc. Special thanks to Governor Wolf for being part of Saturday Night Live with PhillyLabor here on Talk Radio 1210 WPHT, a special Saturday edition as we roll on here throughout the remainder of the year. Watch for some more special shows coming your way. On behalf of J-Doc and behalf of Wendell Young, on behalf of the governor, we thank everybody around the Delaware Valley for tuning in. Until next time, I'm Joe Krause.
This program is a paid commercial announcement and in no way represents the views of WPHT or its management.